Let's move on here as a deadly listeria outbreak connected to frozen pasta meals sold in grocery chains nationwide is worsening. The outbreak killing 6 people. 27 have reported getting sick from this. Cases have now been reported in 18 states, including in Virginia. For more on this, we've got HealthTrackRx Dr. Steve Goldberg with this. First of all, let's break down what exactly listeria is, Dr. Goldberg.
Listeria is a bacteria, and it's found in soil and water and on animals. And so at the food processing facility, those facilities got to be really clean. Staff got to be skilled in order to prepare the meals in a very safe way for human consumption.
Okay, so how does that make its way into food supplies of these sorts? I mean, these are frozen meals. How is that possible?
Well, the animals weren't sufficiently clean. The facility wasn't sufficiently clean. The staff weren't sufficiently doing their job. That created the opportunity for this contaminated food to get in the supply chain. So that's what occurred. And what has to happen is those things have to be addressed to prevent this.
Yeah, and some of these foods are ending up at Trader Joe's stores, Walmart stores, and even Kroger stores, which sometimes are same as Harris Teeter. So definitely look out if you've seen some of the packaging that we've been playing here on our screen. But Dr. Goldberg, as far as symptoms go, if someone ate this, are they safe? What do they need to know? What do they need to be looking for?
In its most mild form, you can have a stomach upset. If it gets more severe, you can get a fever. If it gets even worse, you can feel really, really ill and even start showing signs of meningitis. And then sadly, some people die. You've mentioned we've had 6 deaths in the most recent outbreak.
Okay, so if you suspect you may have listeria, how do you go about treating this? What should we do? What are next steps?
Consult with a clinician. When in doubt, consult with a clinician, because if you're moving down the serious illness where it's getting worse, you got to get treated. You likely need antibiotics, and that has to be done quickly rather than later.
Okay. How long usually does this work to get out of your system?
For people with mild cases, they oftentimes don't even know they have it, and they clear it without antibiotics. It's the more serious episodes with the fever, with feeling very sick, with mental status change. Those are the things that require getting a clinician's visit.
All right, Dr. Goldberg, thank you for walking us through that. I think very important considering just how many deaths right now are being reported, and of course the fact that it's being sold in Virginia. Thank you so much for the update. We appreciate it.